Hi, this is Justine, PA at Parsa. Today we're going to demonstrate on how to apply the Cosmelan Peel on a patient in the office. You could also do this and use this reference as a guide to do it at home. I just did the Cosmelan 2 days ago, so this is kind of the process of what to expect. I'm a little bit red, a little bit tight, and you can see I'm starting to peel, which is totally normal, and I'm still slightly swollen under the under eyes, but that's completely expected as well. So when you unbox your Cosmelan, it comes in with everything you see here. This is the Cosmelan Peel Pack with everything inside. Today we're using the Cosmelan 1, which is the chemical peel that we'll be applying. This is the skin prep solution that we'll use to prep the skin. This is the headband to keep your hair out of the way. Popsicle stick or tongue depressor to apply the Cosmelan. A Q-tip to help with the application. A piece of gauze to apply the skin prep. Some gloves to keep your hands clean. So our beautiful patient is here for the Cosmelan Peel to help with her hyperpigmentation and melasma. Melasma is due to hormonal changes. It could get aggravated from sun exposure or stress. And we are helping with her hyperpigmentation on her cheeks and on her upper lip. We're just gonna do the peel everywhere. So first I'm putting on gloves. And next we're going to prep our patient's skin using the skin prep. The skin prep has some alcohol in it, so the vapors might feel a little bit strong. You might smell it and get a waft around your eyes. So just close your eyes. If you're doing this at home, it comes with a piece of gauze. You're gonna fold the piece of gauze into fours. You're gonna wash your face with gentle cleanser beforehand. You're gonna take the skin prep solution and saturate the gauze. Make sure it's pretty soaked in, but not too drippy, so it doesn't get into your eyes. Next, we're going to prep the skin really well. The vapors are kind of strong, so you might smell it. It might smell like alcohol. Keep your eyes closed. We start from underneath so the solution doesn't drip into the eyes. I'm wiping in 2 directions, making sure we're getting to the crevices of the nose and the upper lip. Being really thorough with what we're cleaning to strip the skin from any oil so the peel could be more effective and penetrate the skin better without all the oils as we're degreasing the skin with the skin prep solution. So this is the Cosmelan 1, but make sure it's Cosmelan 1 and not Cosmelan 2. This is what the chemical peel is. It looks like peanut butter. We're taking the tongue depressor. We're gonna mix the chemical peel. It's like a smooth paste. Get a glob on, and we'll start applying it onto the patient. Or you could apply it on yourself at home. So usually we want an even coat of Cosmelan on the entire face. We'll start at the hairline down to the brow area. Make sure not to get it on the upper eyelid and not above the orbital rim, which is the bony area right here. We're gonna get an even coat all over the face, into the crevices of the nose, on the upper lip especially, because this is her main area of concern, but not make sure to get it onto sensitive areas like the lips. So next we're just applying it to the face with an even coat everywhere, kind of like frosting a cake. It's not going to be perfect, but we just want an even layer everywhere. As you can see, our patient is wearing the headband that we provide to hold the patient's hair back as we're applying the Cosmelan. So make sure you're tying up your hair, keeping it out of the way when you're doing this at home. As you're applying the Cosmelan, it shouldn't feel like any sensation. It's not sensitive. It just feels like a clay mask on your skin. It shouldn't be burning or stinging at this point. So I'm just applying the peel, painting it onto the skin and feathering it out down to the jawline. And then we'll use the Q-tip later to cover any areas that need a little bit more precision. So I'm feathering it out see how this area is a little bit thick? I'm just scraping it all off, like icing a cake a little bit, just to get nice even coverage everywhere, covering the whole face up until the hairline and down to the jawline, not to go below the eyebrow and not too close to the lash line. So now I'm taking the Q-tip to fine tune our application to make it a little bit more precise, to cover all the areas where the tongue depressor might be a little bit too thick to cover, like that, just so we get an even coat everywhere. So this is after the application. This is how it should look. It's smooth on some areas, but some areas might crack throughout the day when you keep it on. We made sure not to get on the upper eyelid and not too close to the lash line underneath. Avoid sensitive areas like the lip, but we are treating her main area of concern, which is her upper lip, so we got as close to the actual lips as possible. Brought it down to her jawline. As you could see, our patients typically keep it on for 8 to 10 hours. That will be determined by your provider. You'll want to keep the Q-tip on hand in case you have an itch somewhere. Like if you have an itch, you want to take the end of the Q-tip to scratch little areas, and then you can move the peel back. Don't scratch with your hands because you might scratch off some of the peel. Not a big deal if that happens. You could just kind of coat it over again with the Q-tip or the tongue depressor if you kept it. To wash off the peel afterwards, you could just wash it with warm water, lukewarm water in circles. You could also wet a washcloth to wipe off the chunks before you wash your entire face in small, gentle circles. The peel shouldn't sting or be tingly at this point, but closer to the end of when you're taking off the peel, your skin might be a little bit sensitive, a little bit tingly, but not super uncomfortable. And then when you wash it off, it's normal to be red, a little bit swollen. And usually the next morning, it's totally typical to be pretty red and pretty swollen sometimes. As you can see, I'm day 2, I'm red, I'm peeling, I'm not as swollen anymore, but it's okay if you are. Some patients, after a couple days of the Cosmelan, they do feel like they have a mild sunburn with a burning sensation and irritated skin. That's completely normal. Other patients, it's just really dry and tight. It kind of varies depending on how sensitive your skin is, but totally normal to feel irritated, a little burny sometimes. It's a little bit burny when I take a shower just with the warm water, and some products might feel a bit sensitive, so we're just keeping most patients on a gentle cleanser and the at-home aftercare kit that comes with the Cosmelan pack. These are the products that come with the aftercare pack after you take off your chemical peel. This is the Cosmelan 2, which you will be using a couple times a day depending on your provider and what they advise. This is the recovery cream, which is a hydrating cream. You could reapply this throughout the day. You're gonna feel pretty dry and pretty tight, so you'll probably wanna use this more often than just when you wake up and going to bed. And this is the tinted sunscreen. Use this and reapply throughout the day to protect your skin, especially over the next 2 weeks after the peel. You're gonna be really sensitive to the sun, so that's why we recommend doing a peel when it's less sunny, like during the winter months. This is a good tinted sunscreen to help mask the redness. You can see I have some on right now, and this is what you'll be using for the next week or so and start incorporating into your routine week 2. So the Cosmelan 2 helps push the effects of your peel and also help fade your pigment. After you take off the Cosmelan 1 and wash off your face, you'll still see some hyperpigmentation, some pigment, but using the Cosmelan 2 as instructed will help push the pigment out further and lighten up the pigment. This could be a little bit irritating and drying, but follow your provider's instructions on how to use it. Cosmelan 2 does have a slight orange tint to it when you start using it. It is a little bit irritating, so don't be alarmed if when you apply it to sensitive skin right after you take off the peel, it might be a little bit burny and it might have a slight orange color to it.